Welcome to today's Practice Advantage Pearl, Marketabilities, Part 1. Today I'd like to talk a little bit on the applications of how physicians like to receive the information from a marketing referral development standpoint. I certainly have a little bias to that. I think that since the overwhelming preferred communication is word of mouth, that clinician-to-clinician really speaks strongly when it comes to developing the referral channels and marketing your practice. So again, clinician-to-clinician involves several components. I'd like to go over several of them right now, and hopefully we'll get a chance to cover more of them in the future. The first one is clinical shadowing. And clinical shadowing is based on a foundation of having referring practice send individuals, or perhaps it's a health plan physician, to your practice and then reciprocating back to their practice by having some of your people shadow them. The key here is, with any marketing, core to what's going on is what? It's having a great patient outcome and having great patient satisfaction. We know that the negative word travels farther and faster than the positive word does. So taking great care of the patients, and that comes from everybody in your practice, is prerequisite to making sure that you're having somebody come and clinically shadow. You want to show them your best side. I oftentimes think about a situation with my mom where she saw a great clinician, she got great care, and decided not to see that physician because they couldn't get her bill correct. So even though it was great clinical care, they messed up her bill, which was a situation where she really made a choice based on that. The second practice that she went to, again, a great clinician doing great care, they didn't return phone calls. So from that standpoint, she was sure that she told people, you'll never get a phone call back here, or they'll mess up your bill back here. The next place that they went for their care turned out to be great. They had great business and clinical operations both. And guess what? They were driving 70 miles one way for that care, and they were sure that they told everybody about that. So anchor this in great clinical and business care for your patients. The second point is clinician orientation. Say you've got a referring practice, they've hired a new clinical person on staff. Maybe it's a non-physician provider, a PA. Early on in that hiring process from that referring practice, an invitation from your practice to have them shadow at your practice may be a powerful tool for training that particular person in really the nuances of your specialty or subspecialization within your specialty. So a great opportunity there. The challenge, though, is finding out when they're onboarding somebody and getting on the schedule early before they get too busy in their practice. Next, I'd like to talk about one-on-ones. Physician to physician, physician assistant to physician assistant, MA to MA, whatever that might be in your practice, a one-on-one situation. I think about two nurse practitioners in a practice, prime opportunities for helping with marketabilities. Two different personalities, one an introvert, another an extrovert, trying to find a way that they both could succeed at sharing the message for the specialty group. So one idea that I'd put out for you is have one of the nurse practitioners invite a referring practice nurse practitioner or non-physician provider to lunch, do that one time a month, and make sure that in that dialogue you've also tasked them with maybe a market intelligence component as well. The next month, it might be the other nurse practitioner and a different question for the referring group that she might invite. Now, those market intelligence questions might be finding out from some of your loyal referral sources why other practices aren't referring. A challenging thing to find out in any marketplace in healthcare, but knowing why certain practices are not referring can be a powerful tool. So a couple of pearls on clinician-to-clinician marketing. Hopefully they'll make some sense for you. I do thank you for listening today, and be sure to watch for future Practice Advantage pearls. Have a great day.